Hi, sir. How are you today?
I'm well. How are you?
I'm great, thank you. My name is Raquel, and I'll be your nurse today, and I will be performing a head to toe assessment on you. Is that all right with you?
Yeah.
Great. The first thing I'll do is perform hand hygiene. Can you please tell me your name?
James Bond.
James Bond. And what is your birthday, Mr. Bond?
August 2nd, 1978.
Okay. Do you know where you are?
I'm at home.
Do you know what we're doing and why we're here today?
You're going to perform a health assessment on me.
Okay. And who is our current president?
Donald Trump.
Who were the previous three presidents before him?
Barack Obama, George Bush, and Bill Clinton.
Okay, so the client is alert and oriented times 4. And sir, can you tell me, do you get your regular physical exams?
Yes,
Are you up to date on your vaccines?
I am.
Good. Do you feel safe at home?
I do.
Okay. And do you feel like you have an emotional support system?
Yes.
Is there anything relating to your religion and your health care that I should be made aware of?
No.
Okay. As we're conversing, I'm already forming my general impression. I'm seeing if his responses are appropriate, noting his ease of breathing, are his clothes appropriate for the current season, looking at his posture, if he appears to be in any pain, and so far everything seems okay. Alrighty, sir. Continuing on with our assessment, I will begin with the head, okay? Actually, I will get your vital signs first. Feet flat on the floor. Very good. I will begin by palpating his radial pulse. Okay, his radial pulse was no longer palpable at about 120, so I will reinflate to about 150.
Excuse me.
Okay, sir. Your BP was 118/76. Very good. I will now assess your pulse for 30 seconds. Excuse me, I will assess your pulse for 1 minute. I would assess his pulse for 30 seconds. In the final 30 seconds, I would assess his respiratory rate, but I wouldn't tell the patient that to not affect their breathing. Alrighty, so find his pulse and begin timing. Alright, very good. So your respiratory rate was 18 breaths per minute, and your pulse was assessed at 80 beats per minute. So very good both ways. Continuing on with our assessment, I'll begin with your scalp. Now, I'm inspecting the color of his hair. It is consistent throughout, and looking at the distribution of hair. I'm looking for any lesions, any masses, any ulcers. Sir, are you aware of the spot on the top of your head?
I have a birthmark.
A birthmark? Alrighty. Moving down to his eyes. His eyelids are not swollen. Neither eyelid is drooping. Sir, would you mind standing up, please, and facing me? Please cover your left eye. I will assess cranial nerves 3, 4, and 6. Now, looking into my eye, tell me how many fingers I'm holding up.
1.
Okay.
2.
Please cover your other eye. Same thing. Look into my eye. Tell me how many fingers I hold up.
1.
Okay.
5.
Okay, very good. I will now turn the light off to dim the room. Sir, please look into the distance. Straight ahead. Straight ahead. I will shine the pen light into his eye and assess his pupil constriction. Coming in from the side. Okay. Coming in from the other side. Very good. Alright, sir, if you could please follow my pen light. Very good. No strabismus. I'll turn the light back on. His pupils were equal, round, reactive to light, and accommodating. Thank you, sir. Now moving on to cranial nerve 5. If you can just bite down for me. Feeling his temporal muscle. His masseter, very good. Alrighty. Now to assess cranial nerve 8. Sir, I will whisper something behind you. I want you to cover your left ear and tell me what I whisper to you.
Apple pie.
Alrighty, please occlude your right ear. I will whisper something behind you on your left side, and please repeat what I say.
Piano.
Very good. Alrighty. Now, assessing cranial nerve 9, if I had a proper tongue depressor, I would insert the tongue depressor and ask the client to say ah and observe the uvula being raised. And I would also check to ensure that he has an intact gag reflex. For now, I will go ahead and move to cranial nerve 12. Sir, stick out your tongue, move it up and down, side to side, and can you say light, tight, dynamite?
Light, tight, dynamite.
Fantastic. Alrighty, we will assess your range of motion of your temporal mandibular joint. Okay, so just open and close. I'm feeling for any crepitus. Open, close. Okay, very good. Now I will palpate your lymph nodes, okay? Preauricular, post, occipital, carotid. Okay. Very good. Alrighty, now just inspecting the trachea. I see no tracheal deviation. Again, always assessing the skin. It is consistent in color. Very good. I will test his cranial nerve 1, which is the olfactory. Sir, can you please close your eyes? I'm going to place something in front of you, and I want you to tell me if you can smell it. If you can, tell me what you smell.
Vanilla.
Yes, vanilla extract. Very good. Alrighty. So again, using my pen light, I will shine the pen light into each nostril. I will observe his septum, assess if it's deviated. It's not, it's midline. I see no drainage. Sir, can you please occlude one side and breathe in? Okay, can you do the other side for me? Okay, any issues with your nose? Okay, very good. Alrighty. And just inspecting the ears. Palpating any tenderness, sir?
No.
Here? In the front?
No.
Alrighty. Inspecting the ear. No obvious masses, lesions. I'm going to palpate any tenderness, sir?
No.
In the front here?
No.
Okay, and I'll also do the mastoid process. Any tenderness, sir?
No.
Okay, very good. Alrighty. We'll move down to your respiratory system. I will first inspect your thorax, okay? So I'm going to peek inside of your shirt. Is that okay?
Yeah.
Alrighty. Again, noting his skin color, it is consistent with the rest of his body. He does have some body hair, which is normal. Now, sir, I will listen to your lungs, okay?
Mm-hmm.
I will start with the apex of each lung. Just breathe normally, okay? Here we go. Left side. Okay. I'll move down to about the second intercostal space here. Left side. Okay, now my patient's right side. So the right lung has 3 lobes. The left has 2. So on the right side, I will move down to about the 4th intercostal space. And auscultate. Okay, I'll move down to about the 6th. Okay, so far I have not heard any abnormal breath sounds. I will listen to the mid-axillary line at about the 6th intercostal space here. Sorry, sir, I'll pull your shirt down. Okay, just breathe normally for me. Very good. Again, just breathe normally. Very good. Coming posteriorly, I will first inspect, looking for any obvious wounds, lesions, abrasions. Hopefully no punctures or penetrations, but I will look there too. I will palpate the cervical spine. Any tenderness, sir?
No.
Okay. And I will check for chest expansion. Can you please slide to your right just a bit, sir? Thank you. Okay, so putting my hands together. Okay. Now take a deep breath for me, sir. Okay, very good. We'll now continue to auscultate his lungs, beginning with the apex of each. Just breathe normally for me, sir. one final breath for me.
Me.
Okay, very good, sir.
Me.
Okay. Now moving on to the cardiovascular. Sir, can you please turn your body and lean 45 degrees for me?
Like this.
Yes. Can you put your other foot up? Now I will look for a jugular vein distension at a 45-degree angle. Okay, I'm looking at the left vein. It's absent. Again, the right jugular vein, also absent. Okay, sir, you can sit up for me. Now I will palpate his carotid arteries one at a time. Okay. 2+, as expected. Very good. Now I will palpate each of the landmarks, starting with the aortic. I'm going to insert my hands in your shirt again, sir. Alrighty. So, the aortic, at the second intercostal space. Pulmonic. Erb's point at the third. The tricuspid. And the mitral. I will now auscultate at each of the landmarks. Alright, beginning with the aortic. And the mitral. I will now do the same, but using my bell. Pulmonic. Erb's point. The tricuspid. And the mitral. Okay, very good, sir. I will assess for peripheral edema. I'm not seeing any visually. Sir, may I please see your fingernails? I will test the capillary refill by squeezing the nail bed of each finger. Very good, less than 2 seconds. What you want to see? Yes. Okay. Your left hand, please. Okay. Can you please move your wrist up, down, side to side? Any pain?
No.
Alrighty. Please squeeze my finger with your hands as hard as you can. Ooh, very good. Thank you, sir. Alrighty. Now just assessing your range of motion. Tell me if you feel any tenderness or discomfort or pain. No? That's very good. Alright. I'm feeling for any crepitus. I did not note any. Again, on the left side. No crepitus. Any tenderness, pain. Okay. Now I want you to push against me, okay? Push down. Very good. Now up. Very good. Bring your arms up. Over your head. Very good. Down. And can you stand up, please? Face me. Bring your arms back. Very good. Now, back at your sides. I want you to do the same motions, but against my resistance, okay? So bring them up. Very good. Down. All right. Back. Okay. Very good. Alrighty, you may have a seat. No edema, again, his skin is consistent with the rest of his body. No edema noted. And we'll get your renal pulses. It's a 2+ as expected. Now, sir, if I can again get you to lay flat this time. Actually, can you? No, that's fine. I will assess your abdomen, okay? So, I will begin by simply inspecting, okay? I don't see any obvious abnormal contours. Have you been having any issues with your abdomen at all? Okay. After inspection, I will auscultate, starting with the right lower quadrant. Right upper quadrant. And finally, the lower left lower quadrant. Okay, I will switch to my bell. He has normal active bowel sounds. That was the right lower quadrant. Now the right upper quadrant. Okay. Left upper quadrant. And left lower quadrant. I will now listen to the aortic, renal, and iliac arteries. So beginning with the aortic. The renal arteries. All right, and now the iliac. Okay, no bruise present. I will now palpate, starting with light palpation, which is about 2 centimeters in depth, to each of the 4 quadrants. Looking for lumps, masses, or any rigidity. Sir, tell me if you feel any pain or discomfort.
No.
Okay. Okay. Okay, now I will perform deep palpation, about 4 to 5 centimeters in depth, to each of the 4 abdominal quadrants. Again, I'm looking for any lumps, masses, or any rigidity. Any pain or tenderness, sir?
No.
Okay. Now I will assess for rebound tenderness. Sir, I'm going to push into your abdomen. Let me know if it hurts when I remove my hands, okay? No? In there? No. So negative for rebound tenderness. Okay, I will now assess his lower extremities. I'm sorry, I'll provide privacy. Thank you very much. I will now assess his lower extremity for any edema. I will place my finger over the bone and push in to see if it leaves any indentation. known as pitting edema. It's negative. Negative. Okay, can you set it for me, sir? Face this way. Alrighty. I will now inspect his feet. I'm looking at his big toe. Gout can start there. It's normal. I will look at his heel. Ulcers can be there. I will assess the bottom of his feet for any ulcers. Do you ever have any pain on your feet, sir?
No.
His feet are free of ulcers. Okay? I'm going to move your foot. Left, right. Any pain?
No.
Move your foot around for me on your own. Very good. Okay? And I will do the same to the left. I'm also looking at his toenails. Do they look healthy? They do in this case. And I will also do capillary refill in each of his toes. And it should be less than 2 seconds for the blood to return. Okay? I'm going to squeeze each toe, sir. Okay? Very good. Very good. Very good. Very good. I'm also looking in between his toes. Athlete's foot. Everything's negative. Again, looking at the bottom of his foot. There's no ulcers. The heel of his foot. Move your ankle all around for me. Any pain? Okay. There's no edema. Sir, can you bend your legs up and down? Any pain?
No.
Or discomfort? Okay. I will assess capillary refill in the other toes. It should be less than 2 seconds for blood to return. Very good. Very good. Very good. Very good. Very good. And these toenails look healthy as well. Alrighty. Sir, if you can just lay back for me, I'm going to palpate your hips. Just lay back. Or, yes, sir, I guess you can go that way. Excuse me. Alrighty, sir. Can you please bring your right knee to your chest? Very good. And down. Now, I will do it for you, okay? Bringing it up. Any pain or discomfort?
No.
Okay. Now we're going to do abduction. Any pain, discomfort? All right, do the same with your left, please. Very good, and down. Now I will do it for you. Okay. I will palpate the client's hips and the greater trochanter. Any pain there?
No.
Alrighty, very good. Can you stand up for me, please, sir? Face that way. I will observe the back for any abnormal curvatures, any lordosis. I see none. None. Okay. Can you please take steps forward for me? Normally. Just walk normally, sir. Turn around and come back. I'm observing his gait. If he has any discomfort, turn around, sir. It appears normal. Now I want you to walk, and I want you to put your heel in front of your toe on the opposing foot and repeat. Very good. I'm assessing his balance. Okay, you can turn around for me, sir. He appears to have no difficulty. Come towards me. Very good. Now I want you to close your eyes and try not to sway. Very good. You can open your eyes. Can you please take 2 steps back? Right there is fine. Please raise your hands. Now close your eyes. I'm looking for drift in either arm. As you can see, there's no drift. Very good. Okay, you can have a seat for me, sir. To test the muscle strength of his lower extremity, sir, please push against my resistance. Very good. Other leg. Very good. Just going to palpate your shoulders. Any pain?
No.
Tenderness?
No.
Okay. Let's do the other side. your shoulder, sir? Any pain?
No.
Okay, very good, sir. Alrighty, that concludes our examination. Thank you very much. Do you have any concerns that you wish to share with me at this time?
No, not right now.
Okay, thank you very much, sir.
Thanks.